Our health and beauty tip, we do it every single Thursday. Today, Reno Vein is the guest.
That's right. And Kathy and Grace are both in here for Reno Vein Clinic. Kathy is our nursing supervisor at Reno Vein Clinic. Good morning to both of you.
Good morning.
Well, let's kind of start off with what are varicose and spider veins? We were just kind of talking about this off the air because there's a big difference.
Yes.
Which I did not realize this because I thought spider veins turned into varicose veins. That's not the case. Explain to us the difference between the two.
Varicose veins are veins that have valves that have collapsed, valves that are no longer functioning, and you get pressure and it makes the veins get big and fat and ugly.
Oh, yeah, we don't like that.
Yeah.
We don't like that.
Varicose veins are or spider veins are actually caused a little bit by the same thing, and it's just a flurry of little veins that don't look pretty. They can be uncomfortable as well.
Now, what happens generally to varicose veins? These are the ones they're more protruding, they're bigger. What causes that?
It's caused by the valves that are no longer functioning, and so the vein is not pushing the blood back up to the heart. It's not the regular mode of circulation, and so you get pressure and the veins just get fatter and fatter.
Is that because we walk upright and
Yes.
It's all going down?
Yes, it's gravity.
Right.
It's a gravity thing.
Maybe if we hung upside down a little bit more, we wouldn't have those problems.
That's why monkeys don't have them.
And some of these varicose veins, of course, they could be unsightly. That's one of the reasons why you'd want to have them removed. But medically, you need to have them removed, correct?
You really do need to have them treated. They become very, very uncomfortable. Left long enough, you start getting some skin changes. You can get ulcerations, and it's not a pleasant thing.
Well, I love your website, renoveinclinic.com, because you have it kind of goes through and explains what the varicose vein is. You got some great photos, and it kind of explains because what happens to people who have the varicose veins, pretty soon it starts affecting them where they may not be able to walk as much. They're always having to put their feet up. They're uncomfortable. How can varicose veins be diagnosed? What is the best way for people to find out if that's what they have?
The best way to see if that's your problem, if you have unsightly veins, come into Reno Vein Clinic and let one of the doctors do a consultation. Our consultations are no charge. The visit is about a half hour, and they will take your full history. They do an ultrasound, and that is the real diagnostic tool for diagnosing varicose veins.
And the sooner that you diagnose, I'm sure this is true for anything, the sooner that you diagnose, the quicker you can find some sort of therapy that works for you.
Absolutely.
Because I'm assuming that it's more difficult to take care of as longer you have them and the more that they go on. Is that correct?
It's not necessarily more difficult to take care of, but certainly you've gone through the discomfort and recovery. If it gets to the point that you have discoloration, then you're not going to recover that.
Let's talk about the recovery after you have a procedure of this, because I was we were talking about this off the air. You say spider veins, which we'll talk about here in just a little bit. That's a very quick procedure. You could pretty much walk out of the office and everything's good. The varicose veins, downtime is approximately 1 day? Downtime
is about 24 hours.
Now, could you ever consider vein stripping? What is that? I've heard this. It just sounds horrible already.
It is.
Stripping is good.
No, not that kind of stripping. Yeah, because explain this to us, Kathy. I mean, this seems painful.
Vein stripping is a very invasive procedure. It's very painful. Recovery is 2 to 6 weeks. You're off work 2 weeks. Easy. And it's an ugly procedure. You're left with scars all up and down your legs. The procedure.
Don't hold back there.
Yeah, let me tell you how I feel.
Well, and the thing is this is how the procedure used to be done if you had problems with varicose veins. And the Reno Vein Clinic is saying, no, you don't have to have this done. Let us look at you. Let us talk to you. Let us show you some of the different options, treatments that are out there.
Absolutely. There are physicians who still do stripping. There are facilities in our town that have strippings going on every day. We do a radio frequency closure, and it's just such a lovely procedure. In all my years in operating room, it's the nicest procedure that I've seen come along.
And why do women usually have varicose veins? Are there ways to prevent it, to make sure you don't get them?
Varicose veins are largely genetic. Mm-hmm. Obviously, occupation will influence it. Women get varicose veins more often than men because they have hormones and they do the pregnancy thing, and those are all contributing factors. What can you do to avoid that? You can wear compression hosiery, and we do have compression hosiery at the office as well.
See, there's hope for you, Trey.
Yeah, we can get some compression. Do you have it for his head? Because we'd like it just over the mouth sometime. We just want to compress that down.
We do have some that might fit.
Perfect. We can get that for him. Well, if people want to find out more information, because like you said, these consultations are free. So you can come in, you can find out, first of all, do you have varicose veins? Maybe the spider veins these are the smaller ones. Let's talk briefly about the spider veins. What are symptoms of spider veins?
The spider veins, you can have some fatigue. You might have some itching. The biggest thing is they aren't attractive, and so.
What would you say to, let's say, someone that's arachnophobic about spider veins? Can they come in and get treated?
They better get them taken care of quickly.
Because you don't want to look like you have spiders crawling all over you.
That would freak me out.
But, I actually had the spider veins. I had gotten hit with a softball when I was a kid in my ankle, and I had gotten some blood disbursement, I guess. Yeah. And as I got older, it became spider veins. And it was just ugly, and I loved to wear sandals in the summer, and so I had some procedure done, and let me tell you, I was blown away at the results.
It's magic.
They're gone. It's literally like they were gone. I thought that was just something that you had to live with, and even me, I'm in my mid-30s now. I was like, what is this? I can't get these. I thought it was an age thing. And come to find out, it's not. It varies in a lot of different people. And in this case, I was told that it was from an injury. I said, I've been hit there before. I had a severe bruising. But very interesting. If you want to find out more, I highly recommend visiting the website, renoveinclinic.com. Or if you want to schedule your free consultation, you can call them at 329-3100. Again, 329-3100. And they're located at 9480 Double Diamond Parkway. We'll make sure to have all that information up on our Facebook as well.
Very cool. Allison, 96.5.